My name is Monica, and I'm a physical therapist. I will be talking to you students today about whiplash. A little bit of background information. The whiplash is a neck strain that is caused by damage to the muscle or the tendons. We'll talk about injury rates. So about 3 million Americans sustain whiplash injuries each year. About 1.5 million Americans suffer chronic pain from whiplash. About 300,000 of Americans become disabled due to the pain of whiplash. Who is susceptible? Aging significantly increases the risk of whiplash, and people who already have neck problems such as arthritis. Children have 2/3 the risk of adults. Studies show that women are twice as likely to experience a whiplash injury, and individuals who have had prior neck injury may also be more likely to experience whiplash. Causes: occurs when your head is forcefully and quickly thrown backward and then forward. The sudden force stretches and tears the muscle and tendons in your neck. It is commonly caused by rear-end accidents, but we're going to be talking today more about sports. Can also result from sports accidents, physical abuse, and other types of trauma such as a fall. So for sports, football tackles and other sport-related collisions cause whiplash. Also indoor soccer, basketball, wrestling, and diving. Whiplash spine injuries are estimated to occur in high percentages of indoor soccer players and most commonly in defensive players. Signs and symptoms: neck pain and stiffness, worsening of pain with neck movement, loss of range of motion in the neck, headaches at the base of the skull, tenderness or pain in the shoulder, upper back or arms, tingling or numbness in the arms, fatigue, and dizziness. Some people might also have blurred vision, tinnitus, which is ringing in the ears, sleep disturbances, irritability, difficulty concentrating, memory problems, and depression. Immediate care. You first want to ice the neck, then take NSAIDs. You can use a neck brace or a collar only if the doctor recommends. It actually can weaken the muscles in the neck if you use a collar or a brace. Apply moist heat to neck, but only after 2 to 3 days of icing first. Ultrasound and massage. Rest is not recommended because this will cause the muscles to weaken and it can actually prolong pain. Once acute symptoms of neck strain are gone, begin rehabilitation with gentle stretching exercises. So some exercises include range of motion, turning head side to side with pain-free range of motion, walking, which increases the blood flow to the healing tissues, chin tuck, so you use a towel roll behind the neck. This targets the longus colli. It is the stabilizing muscle in the neck, and then you would make a nodding motion. How to prevent: strengthening exercises to keep neck muscles strong and limber. Take regular breaks to stretch and exercise the neck if you sit in the same position all day. So especially for you students who are sitting, it's important to take breaks regularly. Prevention for games. Keep your head up during a tackle. The impact to the cervical spine becomes increased if a player's head is dropping during collision. Avoid head-to-head contact. Condition the muscles. The stronger the neck is, the more muscles in it will be capable of absorbing impact from collision. Warm up and cool down. Muscles are more likely to tear or become sprained when not stretched. Brace techniques. A brace is not recommended. In most cases, people do better when they gradually return to regular activity. And I mentioned before that a brace can actually weaken your muscles too and prolong the pain. If there's a confirmed ligament tear or fracture of cervical vertebra, a soft collar is then recommended. So the cervical brace or the collar provides support to the neck as the soft tissues heal from injury. And here are my references. Thank you for listening.